Hi everyone, in this video we will talk about cystic fibrosis. So cystic fibrosis is an inherited disorder. It's the most common autosomal recessive pediatric illness. Autosomal recessive means that we need two defective genes to get the disease. So for example, if we have a carrier parent, if you have two carrier parents, the father and mother are both carriers, then they've got a 25% chance of having a baby with cystic fibrosis. So the affected person has an alteration on chromosome 7, being the delta F508, the most common mutation. So this is the most common mutation. This alteration leads to the misfolding of the cystic fibrosis transmembrane receptor protein, CFTR for short. Okay, so this protein, when properly folded, is shuttled to the cell membrane, where it becomes a transmembrane protein responsible for opening channels which release chloride ions out of cells and inhibits the uptake of sodium ions by another channel protein. So these are the functions when it's properly working and no defects. So we're talking about the importance of CFTR protein. And these functions maintain an ion gradient that causes osmosis to draw water out of the cell. So this defect in the CFTR protein mainly affects mucus-secreting glands, which are present mainly in the respiratory system, in the lungs, and in the digestive system, particularly the pancreas, and in the reproductive system. Alright, so let's assume that these cells are lining an exocrine duct. And as we said, the CFTR protein is normally embedded in the cell membrane and responsible for opening channels which release chloride ions out of cells and inhibits the uptake of sodium ions by another channel protein. This channel protein I'm drawing here. Okay, so here's the CFTR and the chloride ions transferring outside. So these functions maintain an ion gradient that causes osmosis to draw water out of cells. So here the water balance is appropriate. When the CFTR is defective, then there's no channel that is transferring chloride ions out of cells. There's no inhibition on the sodium channel, so more sodium is drawn into the cells, where water follows. And more chloride ions are inside because there is no CFTR protein transferring them outside. This affects the water balance, and water is not drawn out of cells and it stays in. So this affects the secretions coming out of these cells. So we have less water in these secretions, which makes them thicker. The thickening of these secretions are the hallmark of cystic fibrosis. As for the clinical features of cystic fibrosis, the patients will be having chronic respiratory problems, and because of the buildup of the thick mucus in the lungs, they'll be having cough, recurrent pneumonia, bronchiectasis because of the recurrent infections, sinus tenderness, and nasal polyps. They'd also be having gastrointestinal problems. So we start with the babies. They can first present with meconium ileus in 10% of babies. And because of the pancreatic insufficiency, that is due to the blockage of pancreatic ducts with mucus, They'd be having jaundice, pale, bulky, loose stools, and malabsorption. They'd also be having infertility in males because of the atrophy of vas deferens. So patients with cystic fibrosis usually have early mortality, but fortunately, due to the improving treatment, now we have improving survival rates. The mean age is 31 years. So the diagnostic triad for cystic fibrosis is failure to thrive, chronic cough, and loose bowel actions. So besides the clinical signs, we can do some investigations to diagnose cystic fibrosis. The first one is the immunoreactive trypsinogen. The trypsinogen is produced by the pancreas, and due to the blocked ducts in the pancreas, so we'd be having abnormal drainage and high IRT. In newborns, this test can detect 75% of cases. We can also test for sodium and chloride, the sweat test, and they'd be having high sodium and chloride. And the last one is the DNA testing for carriers, which identifies only the most common mutations, 70-75% of cases. As for the management of cystic fibrosis, there's no cure, but the treatment aims at correcting nutritional deficiencies and minimizing chest infection. We can do CFTR genotyping to determine if the patients are approved for CFTR modulator therapy. There's also the airway clearance therapies, and that can be done through inhaled airway clearance agents such as the DNase and the hypertonic saline. There's also the chest physiotherapy and exercise. We can also aim at prevention of infection, and that can be done through vaccinations, the seasonal influenza vaccine and a pneumococcal vaccine. We can use bronchodilators, anti-inflammatory therapy using azithromycin, ibuprofen, and inhaled glucocorticoids. We also treat any infections and oral pancreatic enzyme replacement. Dietary manipulation can also be helpful, and lung and liver transplantations are considerations. So that is it for this video. Thank you so much for watching. If you have any questions or comments, please leave them below. Subscribe to my channel and ring the bell to get the latest videos.